Good afternoon and welcome to A Time for Change. I'm Khemlani here with Marquise Francis. Today's the first day of Black History Month, and we're going to kick it off speaking about the jump in Black medical student enrollment in a moment. But first, climate change. It's top of mind right now as storms continue to rage around the planet and as the world prepares for the start of the Winter Olympics, which will take place for the first time entirely on man-made snow this year. Opening ceremonies are on Friday, and people are asking, with global temperatures rising, will we hit the point when there just isn't enough winter for Winter Olympics?
Right, and I put that question.
Well, I mean, we talk about it all the time. It's in decision making, for races, for just skiing in general. I mean, you can't deny that global warming exists and that the world is changing and that we have to make the change in a huge way. But I mean, skiing is not going to exist. Winter sports are not going to exist if we continue down this path. And, we see it firsthand. I grew up skiing on glaciers in Austria since I was 9, and they don't exist anymore. And so, for us, again, it's right in front of our faces, but to many, it's not quite as apparent. So I'm not sure how we can make a change substantial enough to fix what's happening. But I know that sports can have a big role in it, because I think that we can shed light on, to people that maybe don't believe in it or aren't convinced.
And that was alpine skier Lindsey Vonn, who won 3 Olympic medals and is now an NBC Olympic correspondent. She was talking about the effects of climate change to the Winter Olympics. And our first guest today does not need any convincing that not only is climate change a real thing, but it's also catastrophic. In fact, he's working to inform others that it's really now or never. Let's bring in Mustafa Santiago Ali, an environmental justice activist and policymaker, someone whose perspective is necessary to the conversation, but especially this month. Mustafa, thank you so much for joining us today. I simply want to start, are we at risk of losing winter?
Well, every aspect of society is going to be impacted by climate change. And of course, winter and our seasons are connected to these changes that we see happening all across our planet. So the answer is yes. The answer is that, winters will become less cold in many places across our planet. And as we move throughout this century, as temperatures continue to increase, we'll see many difficulties for folks who actually survive on winter-related types of activities and food sources and a number of other things. But the good point is that we can actually make change happen and begin to mitigate many of those impacts.
Right, Mustafa, you've worked at the Environmental Protection Agency, the National Wildlife Federation, and the Hip Hop Caucus, in addition to many more. And oftentimes with working with people, I think you understand probably more than most that folks don't really change unless they're personally affected. So when will people kind of wake up to that idea, and how much is climate change actually costing Americans?
Well, a lot of folks are finally starting to wake up. We actually need some politicians to catch up with folks. But when you look at many of the surveys, especially of younger people, folks who are 30 and under, climate change, they know is not only real, but they expect real actions on that. In many instances, they vote on that issue along with a number of other issues. They also understand that if we don't move forward very quickly and with a very set of comprehensive actions, that it is going to impact their lives more than some of the older folks who are in our society. And the economic costs are huge. We know that over the last 30 years, we've spent over $2 trillion on climate-related crises. We've spent, hundreds of billions of dollars just in our country related to storms, related to floods, heat events, and a number of other items. So all of this comes together for a lot of folks in saying that we have to make change happen. Because if we don't, there will be huge economic costs, both in our country, but across the planet.
Mustafa, Anjalee here. Going to your experience at the EPA, we know that we've seen the EPA really have to shift its strength and its strategy as per the whims of various administrations over the years. I wonder, how do you feel that's affected us as a country and our ability to actually tackle climate change now?
Well, we have a president now in this moment who not only says that climate change is real, is willing to actually lean in and put some actions behind it. So you see a number of really positive steps that are happening at the Environmental Protection Agency to address a number of the air pollution. Air pollution is one of the drivers in the warming up of the planet. And we know we've got over 100,000 people who die prematurely from air pollution. And that same air pollution that is taking lives is also playing a role in warming up our oceans and our planet. We also have a president right now who says we have to have an all of government approach, which is incredibly important as well, because we know that the Environmental Protection Agency can't do it by itself. We need to have a number of other agencies and departments that are also building the criteria into their decision making, making sure that resources are making it to the spaces and places that need them the most, and then to also move forward on the technology that's also going to be a part of it. And of course, centering the work around our most vulnerable communities, those environmental justice communities that have been on the front lines for decades fighting to address pollution and now the climate crisis.
Mustafa, you've been doing this work for decades, as I laid out earlier, all those organizations you've been working with. But I'm curious, are there folks that look like you and I on the front lines of this climate justice activism, but also the policy? And I'm curious, from when you started to now, how have things changed over time?
Wow, when I first started, I started as a student, and I remember going to one of my first meetings at the Environmental Protection Agency, and there were two older gentlemen walking in front of me, and they said, I don't know why we're going to this meeting because what the folks are sharing can't possibly be true. Now we fast forward a number of decades, and you do see a number of folks in the policy space, although we need more, who are folks of color, who are actually bringing their sets of experiences, their innovation, their ingenuity into helping to make sure that policy is more reflective of the needs that are out there. We also, see that there's some real change that's happening across the federal family. The Interagency Working Group, the White House Environmental Justice Advisory Council, a number of these different pieces are bringing forward frontline voices and making sure that their sets of requests, their solutions and recommendations are being integrated. But we have a lot of work to do and time is ticking. And that's probably the biggest challenge is that we really have to get the majority of folks coming together to make sure that we have comprehensive sets of actions, making sure that we have a just transition, knowing that no one gets left behind, and that we are investing in the clean economy, which is so critically important, especially for vulnerable communities who have often been locked out of many positions, but also in making sure those workers who have been in the fossil fuel industries know that they are still valued and honored and needed as we move toward that clean economy. All of these things are happening in this moment, but we've got to keep pushing and demanding that change happens at an even faster rate.
I'm so glad you brought that up, because speaking of vulnerable communities, we've seen how this pandemic has shown the fractures, not only in our society, but also in our information systems. And so I wonder, even though we've seen, companies maybe take a lead in small efforts or small policies being put in place, we clearly as a country cannot handle mandates. And so I wonder, how do we get out there? How do we start to push for this greater change? To your point of more is needed, what more can we do?
Well, we have our own sets of personal responsibilities as individuals. Where are we investing our dollars? That's a question I always pose to folks. Are we supporting those who are trying to move forward on a 21st century set of actions? Or are we supporting those who are being an impediment to the changes that are necessary? Are we utilizing our vote, getting engaged in the civic process? I never tell anyone who to vote for, but I do say vote for someone who cares about your community, somebody who is forward focused and forward thinking, not only just about the sets of challenges we have in front of us, but also the sets of opportunities that are there as well. So we have so much more power. My mom says you have power unless you give it away. We've got to realize that power. We also have the power to actually reach across and to connect with folks who might not necessarily see things the same way that we do, but after we actually, connect with each other on in our own humanity, then we have an opportunity to build collaborative partnerships. And we have an opportunity also to have organizations, trusted organizations like the Union of Concerned Scientists, to be able to make some connections with folks, to make sure that folks understand that science is real, science is not biased, but that science is also helping us to have a blueprint for moving forward, and that our policy and our politics needs to line up so that everyone can be in a stronger and healthier and more sustainable position as we move forward.
Yes, Mustafa, you talked about a clean economy, and I just can't get over your clean pink turtleneck and pink pocket tie. So I appreciate that on the first day of Black History Month. Mustafa Santiago Ali, environmental justice activist, thank you so much for joining us today.
Thank you.
Coming up, from the fight for environmental justice to the fight for health equity for patients and doctors, right after the break.
Welcome back to A Time for Change. The ongoing coronavirus pandemic has disproportionately impacted minorities and vulnerable populations. And amid mounting staffing shortages for many health professional roles, one new statistic stands out. The number of Black medical student enrollment seems to be on the rise, up 21% in the past year, according to a recent NPR report. Here to discuss that and more is Michellene Davis, CEO of National Medical Fellowships and a former hospital executive. Michellene, thanks so much for joining us today.
Thank you so much for having us.
So I want to get your take on this. Black enrollment up, that seems to be tied to the pandemic, is it not?
I believe that it is in fact tied to the pandemic, but also the sense and sensitivity around the level of awareness of the impact and effect of that pandemic in communities that have been made vulnerable as a result of historical disenfranchisement and underinvestment. We literally are seeing the fact that for those of us in health equity who have been talking about how structural and systemic racism and inequity has really created vulnerable communities across this country, that now that others have seen it as well. And so I firmly feel that the students who have applied in these increasing numbers, which is a fantastic thing, not just for us, but for everyone, that truly it is as a result of seeing the impact of something like this virus literally hitting communities of concern, featuring individuals that they love and know, and understanding that they have an opportunity to do something about it.
And Michellene, I'd love for you to really illustrate what that inequity looks like. How equal is the care that people are getting these days? Can someone like me walk into the emergency room and know that I'm getting the same treatment as, let's say, a white man or an Asian woman?
Well, my friend, the issue there is that what statistics tell us is that there's a high probability, a high likelihood that, in fact, you would not be receiving the same level of care. And that is despite your level of income. That is despite your coverage, your healthcare coverage, whether or not you are a government subsidized payer or whether or not you are a private payer. That is despite your educational attainment and socioeconomic status, right? So what we know is the fact that we really need to strive for a more equitable future where everyone really has an opportunity to the same level of high quality, high culturally competent care. And that is not something that right now we can guarantee that you are actually receiving. And that is not just me that is saying that. Undoubtedly, study after study has evidenced the fact that implicit bias and outright structural and systemic racism has so perpetually influenced the American healthcare system that what we see now is not just the fact that there are certain health outcomes that are bettering, but that literally, as the general population's health outcomes are better, that for BIPOC, that is Black, Indigenous, persons of color, their healthcare outcomes are actually worsening. And so as a result of that, what we are seeing is the widening of the health disparity gap across the country. And this is in many different areas, unfortunately. Lots of folks and lots of talk have recently been really focused on maternal mortality. And the fact that a Black woman with an advanced degree has the same or worse outcome of mortality than a high school dropout who is white is something that is significantly concerning. But when you take a look at the fact that in certain pockets of this country, like New York, for example, a Black woman is 12 times more likely than her white counterpart to literally pass away after the process of actually bearing a child. There needs to be some time for someone to say that is enough. And one of the things that I like to say at National Medical Fellowships is the fact that we are done dying. And so what I believe that we are seeing right now is that students have said, not only are we done dying, but we are also at a point where we realize that we are an aspect of the answer. We are the actual solution for our own communities. And so as a result of that, we literally are seeing the fact that the same students who over the past summer have taken to the street in order to march after the horrendous and unjust murder of George Floyd have now marched into medical school admissions offices and will be marching into medical school.
Michellene, I want to talk about all of this because we know, you and I have talked over the years about population health, which became social determinants of health, which now became health equity. We've seen that metamorphosis of the idea of exactly all of this, and it seems like we somehow end up having the same conversation. So looking at all the data that we have now, looking at the movement and the focus on health equity right now, where is the solution in all this? Does it come largely from a shift in the population of caregivers? Does it come from maybe just more data in the hands of everyday individuals? How do we move forward from just having this conversation over and over again?
Thank you, Anjalee. I actually think that indeed it's a multifaceted approach, but it is an approach which incredibly depends upon the diversification of the healthcare workforce. And when I say that, please know that I am indeed focused on the physician, but not just the physician. What we have seen is the fact that across the country, state legislation has increased the access and authority for individuals like advanced practice nurses and physician's assistants. So we need to make certain that indeed all of these areas are areas where individuals from the communities of individuals that they are serving, right, that they are present in those spaces. But we also need to make certain that we are holding individuals and institutions accountable. I mentioned earlier cultural competency. Well, that means that you have to face your implicit bias not once a year in some diversity and inclusion training. That means on a daily basis, you as a healthcare practitioner must challenge yourself, understanding all full well, not just the fact that here we have this data and these outputs today, but that historically, healthcare has literally been built on the backs of impoverished and oppressed individuals, right? So if we take a look at just the science of obstetrics and gynecology alone, what we know is that Dr. Marion J. Sims literally built it on the literal backs of African Americans who were enslaved, women who were operated on without anesthesia, right? So we know that this has happened, and yet healthcare institutions at times like to move forward without actually looking back and understanding that there must be something that occurs that evidences that, yes, this happened, we acknowledge it, we recognize it, we wish to correct it. And so as a result of that, we're going to make certain that our own systems and practices and processes and procedures, that who we hire and how we hire, who we recruit, how we retain and matriculate is reflective of our contribution to systemic racism, right? So to that point, you ask about the data. Is it important to get data into everyone's hands? Well, I think this. Not only is it important for just those of us who are devoted to health equity to be well educated about this and to understand it, and not only is it important for the healthcare provider, but it's also important for the everyday patient. Individuals understand, and over 48% of African Americans have indicated that they have experienced a negative experience in a healthcare setting within the last year. So what we know is the fact that if they are also given the data and provided with an opportunity to truly be empowered to advance this for themselves, and if they are doing so within a system that acknowledges what their historical contribution has been to the disenfranchisement, marginalization, and poor healthcare outcomes for certain populations, then we may actually stand a chance. But there is no way through this problem, over it, around it, or under it, that does not center a focus on the need, the evidence of the impactful need, an immediate need to ensure that we are achieving higher levels of diversity in the healthcare workspace, especially in clinical spaces. And Anjalee, I'll tell you this, I did not leave high academic medical center system in order to come to NMF just to ensure the pipeline of BIPOC students interested in medicine. I came here to ensure the pipeline of BIPOC physician leaders. We need to make certain that these individuals are poised and given the opportunity to lead the systems and structures that we have already known for years that they need to change, right? And so we need to make certain that they're having access to the opportunities that prepare them, equip them, not just recruit them, but then create environments in which they can thrive, not just survive, in order to ensure that they're matriculating to leadership positions. And that, my friend, may finally get us over the trenches and actually to the land of health equity.
Something that we know we've seen across industries as well. Unfortunately, we have to leave it there. But Michellene Davis, CEO of National Medical Fellowships, thank you again for joining us today.
Thank you for having us.
Coming up, Black History Month meets the Winter Olympics. Notable Black winter athletes still ahead.
Welcome back to A Time for Change. Since today is the start of Black History Month, and this week is the start of the Winter Olympics, we want to take a moment to look at some of the big moments for Black athletes in the Winter Games. Of course, the Winter Olympics is not historically known for its racial diversity, but that hasn't stopped a few superstars of color from making their mark. Like figure skater Debbie Thomas, who became Team USA's first Black athlete to win an Olympic medal. It was in 1988 in Calgary that she took home the bronze. And it wasn't until 2002, just 20 years ago, that Vanetta Flowers became the first Black athlete from any country to win gold in the Winter Olympics. She was a Team USA bobsledder at the Salt Lake City Games. In Beijing, keep an eye out for Erin Jackson, who is back at the Olympics after becoming the first Black woman to qualify for the U.S. Olympic long speed skating team 4 years ago. And one of my favorites, the Jamaican four-man bobsled team. They're back at Beijing this time around, their first Winter Olympics in more than 20 years. And if folks recall, Cool Runnings may have an opportunity for a comeback. That's all for our show today. I am Marquise Francis.
And I'm Anjalee Khemlani.
Thank you so much for watching. Stay with us, and there's still so much more ahead.